At UMass Memorial, in particular with our new cancer center, we have the ability to tailor our discussions and our screening to people based on the needs of that person or that family. So for example, if somebody has a new diagnosis of cancer, we can talk about whether or not there is a gene basis for that, and if so, what implications it has for their treatment and for their families. It also happens at times that people have multiple cancers in their family and they're concerned that this is something that they could inherit, in which case we can sit down and discuss that with them and talk about whether or not there is testing that may be useful to them to help understand their risk and choose their medical therapies appropriately. We have long worked with the breast cancer team, both for assessing whether or not somebody would be at increased risk, but also whether or not somebody who has a new diagnosis of breast cancer is because they have a gene at the basis for that. Such a gene is fairly well known and it's called a BRCA gene. And this is something we've been doing here at UMass Memorial for a number of years. One of the exciting things that we're doing here at UMass Memorial is that for people who have a new diagnosis of colon cancer, we're able to now screen that tumor to see if there's a higher risk of having a gene at the basis for that. If that's true, it can not only determine some forms of treatment and what the other doctors would choose to do, but also has implications for other family members about whether or not this could be something that's risky for siblings or for children of that person. One of the things that I think that UMass Memorial can offer is greater access for patients and families. We are able to see people relatively rapidly without much of a wait, and in fact currently there's no wait for any of our services. This contrasts to other centers in our state where often there's 3 or 4 months wait before you can see a genetics professional.